Welcome back to TalkTensors listeners. Today we're diving into something pretty fascinating, a paper called FMT, a multimodal pneumonia detection model based on Stacking MOE Framework.
Oh yeah, this one is really interesting.
Yeah, and it really caught our eye because it's tackling this challenge we see a lot in machine learning, dealing with incomplete data.
Right, yeah.
Imagine, you're trying to diagnose pneumonia, but sometimes you're missing parts of the patient's medical history. Or maybe the x-ray isn't totally clear.
Exactly, and that's a problem that happens all the time in real-world clinical settings.
Right, and that's the exact problem that FMT is aiming to solve, and it does so with some really impressive results.
Like a 94% accuracy rate?
Yeah, 94% accuracy in pneumonia detection, which is, amazing. And that actually surpasses not only the methods that just rely on a single type of data, but even specialized benchmarks like CheXpert.
Yeah, CheXpert was specifically designed for this task, and FMT still outperforms it.
Yeah. So it's not just looking at an x-ray and saying pneumonia or no pneumonia. It's about integrating all these different sources of information like a real doctor would do in a clinical setting.
Yeah, it's really about mimicking that human decision-making process as closely as possible.
But before we get into all the details of how FMT works, I think it's important to understand why this is such a big problem in the first place. So why is relying solely on x-rays for pneumonia diagnosis so tricky?
Well, x-rays are incredibly valuable, don't get me wrong, but they don't always tell the whole story, especially in the early stages of pneumonia.
Yeah, they can be kind of subtle.
Yeah, exactly. The visual signs might be really subtle. They could be easily missed or even, mimic other conditions. And that's where things get dangerous because relying only on the x-ray could lead to a delayed diagnosis or even a misdiagnosis, and that can obviously have some pretty serious consequences for patients.
Yeah, that makes a lot of sense. It's like trying to solve a mystery with only half the clues. You might get lucky, but you're probably going to miss something really important.
Yeah.
So how does FMT approach this challenge of integrating multiple sources, even when some information might be missing?
So FMT stands for Flexible Multimodal Transformer, and that flexible part is really key here.
Okay.
It's built to handle situations where you might have an x-ray, but a really sparse medical history or vice versa.
Okay.
And to do this, it uses three main mechanisms.
Right, let's break those down one by one. What's that first mechanism?
So the first one is called crossmodal synergistic enhancement. Essentially what it does is it uses two really powerful deep learning models. ResNet 50, which is great for image recognition, and BERT, which is a language processing model that's really good at understanding text.
Okay.
By combining these two, FMT can analyze both the x-ray images and the text information from the medical records. And it basically uses the strengths of each model to kind of get a more complete picture.
Oh, so it's like having two specialized detectives working together, one who's really good at visual clues and the other who's a master at deciphering language.
Exactly. That's a great way to put it.
And they combine their expertise to crack the case.
Exactly.
What about the second mechanism? How does FMT deal with that missing information?
That's where robustness against missing modalities comes in. Basically, during training, FMT is exposed to scenarios where either the x-ray or parts of the medical record are missing, and this forces it to learn how to make these inferences based on whatever information is available.
Oh, so you're kind of training it to be resourceful?
Exactly. It's like you're training it to solve a puzzle with some of the pieces missing. It has to learn how to fill in those gaps based on the context and the pieces it does have.
So it's kind of learning to be like a doctor would in the real world.
Yeah, exactly. Because in the real world, you don't always have all the information you want.
Right. That's really interesting. Okay, let's move on to the third mechanism. How does FMT decide which information to prioritize when making the diagnosis?
All right, so this is where that extensible stacking MOE architecture comes into play. So MOE stands for Mixture of Experts. Think of it like a team of specialists, each focusing on a different aspect of pneumonia diagnosis.
Okay.
So you might have one expert who's really good at analyzing x-rays and another expert who's really good at interpreting lab results from the medical records.
So you have a whole panel of specialists, each bringing their own knowledge.
Exactly. And the MOE acts like a manager who kind of dynamically adjusts the weight given to each expert's opinion based on the available data.
Oh, wow. So if the x-ray is clear, but the medical history is sparse, the MOE might say, okay, let's lean more heavily on the x-ray expert.
Exactly. And if the x-ray is ambiguous, but the patient is reporting symptoms that are consistent with pneumonia, then the expert who focuses on medical history might have more sway.
So it's like a super smart system that can assess the situation and figure out which expert's opinion is the most relevant.
Right. It's really taking into account all the nuances of the case.
This is a really sophisticated way to approach integrating all these different types of information.
Yeah, it's really pushing the boundaries of what we can do with AI in medicine.
Yeah, it really
Yeah.
is. And, this idea of combining multiple sources of data, it's not totally new.
Oh, yeah.
I mean, the roots of FMT can actually be traced back to those early attempts at using AI in medicine.
That's right. Yeah, like those early expert systems that tried to mimic a doctor's decision making.
Exactly.
Yeah.
And those systems relied on this set of pre-programmed rules based on medical knowledge.
It's like a flow chart.
Yeah, like a really
Yeah.
complex flow chart.
Yeah.
If a patient has symptom A, then check for symptom B and so on.
Uh-huh.
But the problem was those systems were super brittle. If a patient came in with a symptom that wasn't in the rule book, the system would just be like, whoa, I don't know what to do.
It wouldn't know how to adapt.
Exactly. It lacked that flexibility and adaptability that a human doctor has.
And then came machine learning, which totally changed everything. Right. Instead of relying on those handcrafted rules, machine learning algorithms, they learn from data.
Yeah.
You feed them this massive data set of examples like, x-rays labeled with pneumonia or no pneumonia. And the algorithm learns to pick out the patterns that distinguish the two.
So it's like showing a child a bunch of pictures of cats and dogs, and eventually they learn to tell the difference.
Yeah, it's a great analogy.
Yeah.
And this data-driven approach led to some pretty big breakthroughs in medical image analysis.
Oh, yeah.
We started seeing AI models that could detect diabetic retinopathy from eye scans, identify skin cancer from pictures, even predict Alzheimer's from brain scans.
So in a way, FMT is kind of building on this whole legacy of AI in medicine, but it's taking it to a whole new level.
Yeah, it is. It's not just an improvement. It's like a fundamental shift in how we think about medical diagnosis with AI.
Okay.
It's about moving beyond analyzing data in these silos and really embracing this holistic view of the patient.
That makes sense.
Integrating all the information to make the best decision.
And that's what's so cool about this. It's not just about, bumping up the accuracy of pneumonia detection, but developing this approach that's way more robust and could apply to so many other medical conditions.
Exactly. And speaking of robustness, one of the key innovations in FMT is this use of masked attention.
Masked attention?
Yeah.
What is that?
So this technique basically allows the model to focus on the most relevant information, even when some of the data is missing.
Oh, okay. How does that work in practice?
So imagine you're trying to read a sentence, but some of the words have been blacked out.
Okay.
Your brain naturally tries to fill in those blanks, right, based on the surrounding words.
Yeah, of course. You use the words that are there to make a guess about the missing one.
Exactly. And that's basically what masked attention is doing in FMT.
Okay.
So if a patient's medical record is missing some details, the model doesn't just freak out. It uses this masked attention to pull out as much information as it can from the X-ray and whatever medical history it does have to make the best diagnosis possible.
So it's like FMT is learning to be a detective, piecing together the clues, even with an incomplete picture.
Exactly. And this robustness to missing data is what makes it so promising for the real world.
In the real world.
Clinical settings, because we don't always have perfect information.
Right. It's interesting how we think of AI as this super futuristic technology.
Yeah.
But in a way, FMT is kind of bringing us back to the basics of good medicine.
Oh, yeah.
Careful observation, considering all the evidence, and making good decisions even when you don't have all the answers.
That's a great point. It's helping us rediscover that art of diagnosis, but with the added power of AI to analyze huge amounts of data.
Yeah, and spot those subtle patterns.
Right, and the patterns that a human might miss.
It's like having this AI partner that's augmenting our abilities.
Exactly, augmenting, not replacing.
Right. So let's talk about the potential implications of FMT beyond just this pneumonia detection.
Yeah, let's broaden things out a little bit.
Because one of the most exciting things about this is its potential to revolutionize how we approach healthcare in general.
Absolutely.
We've talked a lot about accuracy, and those numbers are amazing.
Oh.
But what about those second and third order effects this could have on the whole healthcare system?
Well, one of the most significant potential impacts is a reduction in unnecessary medical tests.
Well, that would be huge.
Imagine a world where we can diagnose pneumonia accurately with just an X-ray and some basic medical history.
Yeah.
Without needing a CT scan or blood tests.
That would save so much time and money.
Exactly. Not to mention reducing patient anxiety.
Oh, for sure.
And, those cost savings could be redirected to other areas of healthcare, potentially improving access to care for underserved communities.
Yeah, that's a huge deal.
Right.
This could be a game changer for health equity.
Exactly. Making sure everyone has access to quality medical diagnosis.
Regardless of their income.
Exactly. And it's not just about access, it's about quality of care too.
Yeah.
FMT could help address the shortage of medical specialists in rural areas,
Well, that's a great point.
providing a level of diagnostic accuracy that, you'd normally only find in a big city hospital.
That's been a problem for so long, trying to bridge that gap between rural and urban healthcare.
Exactly. And AI could be a key part of solving it.
That's incredible. And it's not just geography. It's expertise, too. Even in well-resourced areas, there's this growing demand for specialized medical knowledge.
Oh, absolutely.
And AI models like FMT could kind of act like a force multiplier,
Yeah.
allowing doctors to leverage those advancements in AI to make better decisions.
Regardless of their specialty.
That's amazing.
Yeah.
Yeah, it's really cool to think about AI kind of democratizing access to that specialized medical knowledge.
Yeah.
It's like having a team of experts in your pocket.
Yeah, it's a powerful vision, and it's getting more realistic all the time as AI keeps advancing.
Yeah.
But we also have to remember, any powerful technology, there are downsides and ethical considerations.
Oh, for sure. We can't just get carried away with the cool new tech without thinking about, what could go wrong.
Right. Like, one concern with AI in healthcare is that potential for bias,
Yeah.
If the data used to train the models is skewed towards certain demographics, the model might make inaccurate or unfair diagnoses for people who are underrepresented in the data.
Right. That's a really important point. We've seen that happen in other areas of AI, like facial recognition systems that don't work well on people of color.
Exactly.
So we have to be very careful about making sure that the data used to train these medical AI models is diverse and representative of everybody.
Absolutely. And it's not just about the data itself. It's about the algorithms and the people who are designing them. We need to make sure that these models are developed with fairness and transparency in mind.
Yeah, we need to understand how these models are making decisions and make sure those decisions are based on good medical reasoning, not just, statistical correlations.
And that's where the human element is still so important. It's not enough to just have this black box AI that spits out a diagnosis. We still need doctors who can interpret those diagnoses and consider, the whole patient and their situation.
Right. It's about AI augmenting human intelligence, not replacing it. It's a partnership.
Exactly. And as we move into this new era of AI-assisted medicine, it's really crucial to have these conversations about ethics and responsibility.
Yeah.
We need to make sure that this technology is used to help everyone, not just a select few.
Okay, so speaking of the future of healthcare, let's move into our novel notions segment, where we explore some of the more speculative, but, still possible implications of FMT.
All right, I'm ready to get a little sci-fi here.
What if instead of just diagnosing pneumonia, we could actually predict it before any symptoms even show up?
Wow, now you're talking about real preventative medicine. We're so used to reacting to illness, waiting until someone's sick to treat them.
Yeah, we treat it after it's already there.
But imagine if we could actually intervene, stop pneumonia before it even develops.
It sounds crazy, but is it really that far-fetched? I mean, we already have wearable sensors that track our heart rate and sleep and even blood oxygen levels.
Yeah.
What if those sensors could pick up on these subtle changes that indicate the very beginning of a pneumonia infection before we even feel sick?
The key is data. Just like with FMT, we need a ton of data from wearable sensors, medical records, environmental factors to train an AI that can recognize those early warning signs.
Like training a bloodhound to sniff out pneumonia.
Exactly.
Yeah.
And once the AI sees those signs, it could alert the person and their doctor, and then they could take steps to prevent it.
I love that. Imagine getting a notification on your phone that says, hey, your AI health assistant has detected a slight increase in your risk of pneumonia. Here are some tips to boost your immune system.
Yeah, or even targeted therapies that could stop the infection before it really takes hold.
We're talking about pneumonia becoming a preventable condition,
Yeah.
like getting a flu shot.
Exactly.
It's a big idea,
Yeah.
but I think it's possible if we combine AI and proactive healthcare.
There are definitely challenges, We need to make sure these early detection systems are accurate and reliable. We have to address privacy concerns with all that health data and develop effective interventions. But the potential benefits are huge.
Huge for individual health and for the whole healthcare system.
Absolutely. So let's look at another possibility. We've talked about FMT analyzing X-rays and medical records, but what if it could analyze other data too?
Like what?
Like genomic information or even social determinants of health?
That's really interesting. We know that pneumonia risk is affected by so many things,
Right, from genetics to where you live.
Exactly. So by incorporating all that into the model, we could get an even better understanding of a person's risk. Imagine an FMT that analyzes your DNA, your medical history, your zip code, even your social media activity to create this complete picture of your pneumonia susceptibility.
Yeah, it's powerful stuff. But we have to be so careful about data privacy and the possibility of discrimination.
Right.
We have to make absolutely sure this information is used to improve health outcomes, not to, judge or exclude people.
I completely agree. But the potential for good is so big. Imagine identifying people who are at high risk because of their genes and their environment. We could give them extra support and resources and potentially save so many lives.
We could also develop personalized prevention strategies, tailoring our approach to each individual. It's about moving away from that one-size-fits-all approach to healthcare and towards a more precise and targeted approach.
Powered by AI.
Powered by AI, exactly. As we keep developing these powerful AI tools like FMT, who knows what other amazing discoveries and life-saving innovations are out there.
Yeah, the future of medicine is happening right now. It's a future where AI will be a big part of it, but where human expertise and empathy and ethics have to be at the forefront.
Couldn't have said it better myself.
Well, that wraps up our deep dive into FMT. We hope you found it as interesting and inspiring as we did. Be sure to check out the show notes for links to the paper and other resources. And as always, keep those curious minds engaged and keep exploring the world of knowledge.
Until next time, keep diving deep.